Hi, my name is Gabriela Valareso Gallardo, and my topic is invasive procedures are associated with bacterial endocarditis. Then we have the definition. The bacterial endocarditis, exudative and proliferative inflammatory alteration of the endocardium, usually characterized by the presence of vegetation on the surface of the endocardium or in the endocardium itself, and most commonly involving a heart valve, but also affecting the inner lining of the cardiac chambers or the endocardial airways. Then we have the video about the bacterial endocarditis.
Bacterial endocarditis. It is an infection of the inner surface of the heart or the heart valves due to the bacteria in the bloodstream. The bacteria can grow on the edges of a heart defect or surface of an abnormal valve and continue producing large particles called vegetations that can break off and travel to the lungs, brain, kidneys, and skin. Symptoms and signs vary but typically include prolonged fever, a new or changing heart murmur, and specific vascular and immunologic phenomena. Vascular phenomena include erythematous lesions on the palms called Janeway lesions and splinter hemorrhages in nail beds, and immunological phenomena include round white spots on retina called rod spots, tender lesions on the finger or toe pads called Osler nodes. Anemia is also a frequent occurrence in bacterial endocarditis, although the exact mechanism is poorly understood.
Okay,
In summary,
then we have the application in medicine. The authors identified all adult patients treated for endocarditis in hospital in Sweden between January 1. The authors applied a case crossover design and compared the occurrence of invasive medical procedures 12 weeks before endocarditis with a corresponding 12 weeks time period exactly 1 year early. The authors consider all invasive non-lethal medical procedures except for those that are likely to be undertaken due to endocarditis or sepsis or due to infections that could possibly lead to endocarditis. Then we have the video of application in medicine.
Endocarditis means inflammation of the inner layer of the heart. The heart's wall is made up of 3 layers, the epicardium being the outermost layer, then the myocardium, and then the endocardium, which is the layer that gets inflamed. It turns out that most cases of endocarditis are due to microbial infection of the endocardium, usually involving the endocardium lining the cardiac valves. Why the valves? Well, it turns out that the valves have tiny blood vessels that nourish them, even though they're flopping around in blood all day long. That means that an infection can potentially result from a damaged valve, since that would allow microbes to escape the tiny blood vessels and invade the valve tissue. Or on the flip side, microbes in the blood might enter the tiny vessels within the valve. Either way, a microbe has to first get into the bloodstream, and that might happen if a person has an obvious open wound or an abscess, a dental or surgical procedure, or injection with an infected needle or infected substance, usually while using illicit drugs. Most often the valves on the left side are affected, the mitral valve and the aortic valve, sometimes due to predisposing conditions like mitral valve prolapse and bicuspid aortic valves, but it really depends on the circumstances. Risk factors for either valve include having prosthetic valves, having a congenital cardiac defect involving the valves, having damage to the valves from rheumatic heart disease, and finally intravenous drug use, which typically affects the tricuspid valve. Now the first step that happens in endocarditis is something causes the endothelial lining of the valves to get damaged. And there are a number of ways that this can happen, like previous inflammation or injury.
Okay.
That damage exposed.
Then we have the pros and cons. Emphasis that most cases of endocarditis are not attributable to invasive procedure. Cardiac conditions are stratified into high, moderate, and negligible risk categories based on potential outcome if endocarditis develops. The procedures that may cause bacteremia and for which prophylaxis is recommended are more clearly specified. Then we have an algorithm was developed to more clearly define when prophylaxis is recommended for patients with mitral valve prolapse. We have the video of pros and cons. Okay, then we have the issues applied in Ecuador. The authors identify 7,013 cases of infective endocarditis during the study period, among others, several cardiovascular procedures, especially coronary artery bypass grafting, procedures of the skin, and management of wounds, transfusions, dialysis, bone marrow puncture, and some endoscopies, particularly bronchoscopies, were strongly associated with an increased risk for the infective endocarditis. Then we have the video of issues applied in Ecuador.
Hey everyone, it's Sarah, the registered nurse, Ari. Called IE, and then you have non-effective endocarditis. First, let's talk about the infective kind. Okay, this is where bacteria, viruses, fungus, any type of thing gets into your bloodstream. How would it enter into your bloodstream? Well, through invasive procedures like dental work. I have seen this. Patient gets infective endocarditis. Turns out a month ago they had all their teeth pulled because they were getting fitted for dentures, and they developed this. So it happens. Implantable devices like pacemakers, ICDs, central line placement, or IV drug use, big thing. And what happens is that pathogen attaches to that valve. Now, people with healthy valves can develop this, but if you have a defective valve, you're more likely to get infective endocarditis. And we'll talk about the pathogenesis here in a second of how it happens. And what classifies as unhealthy valves? What happens, what causes a patient to get unhealthy heart valves? Well, whenever you have a heart valve problem, like especially mitral valve prolapse, or they've had a valve replacement.
And finally, we have the conclusions. These studies suggest that several invasive non-lethal medical procedures are associated with a markedly increased risk for infective endocarditis. Okay, thanks.